So we'll quickly move on to the next condition. We'll be talking about the Charcot-Marie-Tooth disorder. Charcot-Marie-Tooth disorder. Okay. So one of the most striking features of Charcot-Marie-Tooth disorder is an hammertoe. Okay, or you could say your feet are arching. So it's actually a group of inherited disorder that actually cause nerve damage. Primary affects what peripheral nerves in the arms and legs. But it mostly starts in the legs, actually spreads to the hands, right? These are the motor symptoms. These are the sensory symptoms. Okay, so what are the symptoms? You'll be having muscle weakness in the legs, the ankles, and feet. Your foot will be arching and you'll be having hammer toes. There will be difficulties lifting the ankles, the foot from the ankle though, that's foot drop. There's awkward or high stepping gait. There's a loss of muscle bulk in the legs and feet. There's decreased sensation or loss of feelings in the legs and feet. All right, that's what we have here. That's a creeping sensation in the legs. All right. So we also have symptoms may now later spread to the hands and arms if the disease is now progressing. It mostly primarily affects the feet though. So it's caused by mutations in the genes that affect the nerves in the feet and legs and hands and arms. So this mutation can now damage the nerves or protective coat which is around the nerves, that's the myelin sheath. Okay. So motor, we say that muscle weakness, hammer toes, foot drop, repeated ankle sprains, trips and falls because of gait disorders, paralysis and all of that. So risk factors is if there's a family history, that's other people in the family have ever had this Charcot-Marie-Tooth disorder, or diabetes or some certain chemotherapy medications can now worsen the symptoms, right? Complication will say that for the foot abnormalities, you can now start having difficulties in walking, muscle weakness and atrophy, increased susceptibility to injuries. Okay, so there's no cure for this, but basically you are trying to manage the symptoms. Physical therapy, orthopedic devices like braces, surgery, and medications can all help to manage the symptoms, right? So that's also for Charcot-Marie-Tooth disorder.